We have for different function, okay, but all these are plant, okay. So that is a good part about it. You don't have a problem with authorities with phyto or micro, okay. Next, I'll just give you another simple example of what these are actual patient treated. We remove the name, okay. When the patient come to us, you know, let's say a hypertensive patient, you have to understand the patient could be 50 or 60 or 40 is hypertensive. It doesn't mean we are going to repair only his heart or artery, okay. We may give an extra dose of heart and artery, but he is aging. All parts of the body is going down. So you have to do a revitalization too. So in other words, we look at his medical report, we look through the medical questionnaire, we look through the history, we look at the hormones, you know, and the report has to be the last 3 months, the latest 3 months, you know, we analyze it carefully together with an endocrinologist or the hormones, then we come up with a protocol to the physician. And these are all given free of charge. We don't charge for all this. It's a free service for us to provide, and it's of no obligation. So it's good for us to provide it to you. Whenever we have your medical report, you can send it to us. We will do it for you, and we will give you the best solution. Because in our team, it's not just the medical doctor. We also have a lot of PhD who are in the research side, the lab side, okay, the biologists, the chemists, the biochemists. And then on the nutrition side, we have our senior nutritionists, we have our senior pharmacists, we have our dietitians, we have everyone in the team. It is important. Just like in the medical team, we have different specialists. So we want to talk about neuro, then we probably have to get some neurologists on that. And we want to talk about liver, we need a hepatologist. You want to talk about heart, we need a cardiologist too. And if what happens if they have a liver cancer, then you need a hepatologist and an oncologist. Okay, then we also have oncologists who go with the pharma way, but you also have oncologists who go with the bio way. Okay, the regenerative way of biological oncology. Okay, so there's a lot in Germany or in most part of Europe. So they are oncologists, but they also practice the different way to treat the patient in oncology, okay? Because in biological medicine, same with regenerative medicine, we always believe that the body can heal by itself to a certain extent, okay? Number two, we must treat and find the root of the symptoms. We are not just going to treat the symptoms. We are not just going to go with the conventional way. Oh, you have headache, you have migraine, you take this pill. No. Oh, you cannot sleep. Okay, tonight you take the sleeping pill. What about tomorrow? What about day after tomorrow? What about every night? Are you going to take sleeping pill every night for the rest of your life? You can't. Okay, because your liver have to work, your kidney have to work. Okay, so we try in every means, even for hypertensive drug or diabetic drug. At the end game is a kidney transplant, you know, or other complication resulting in damage of organs, or shorten of lifespans of the organs, which means you die younger. So the only way is off the drugs means we have to find a solution. To find a solution, we have to go through very thoroughly the medical questioning and look at the report. Okay, this can be gathered from the doctors, your doctors, or from the doctors themselves, or the medical questions. Some of them have to be filled by the patient because we need to know about the history of the patient. Okay, it could be a Parkinson patient, but he had a history of asthma when he was a child. And then you're talking about injecting the cells. Okay, there could be some complication or flare-up of the asthma, despite not having it for 40 over years. You see, so we have to look into all this to analyze. So if someone were to give us sufficient information, then we run into problem. because then we cannot give a totally right recommendation. We want to give the best recommendation. That is important for us. Okay, so this is only one of the things I talk about, precision for hypertensive patient. Of course, we have liver patients who are doing the stem cells or the frozen cells, and you notice we also have to revitalize the whole organ, and that's what we did, you know. Then Alzheimer's patient, okay, Parkinson patient, these are neurodegenerative diseases. Okay, the word is degenerative. That means you are going down, your brain is going down. So of course, you have to give the different types of brain cells. The relevant types of brain cells for the patient must be given. Okay, here you must give the frontal lobe for the Parkinson patient and Alzheimer's. You must give the substantia nigra, because in the first place, there was no substantia nigra. How you expect the dopamine to come in? So obviously, he had to rely on the drug dopamine to maintain his condition. So if we can stimulate still and provide the substantia nigra, that's where regeneration will take place or to be maintained. So these are the important things we have to understand here. Again, the patient could be 85 years old. When we are talking about this patient, he's probably 85 years old, because we have a few Parkinson patients past 80, mid-80s. There's one even 90, you know. So when we treated them, you know, we also have to look into their other problems, and we did. Because you cannot just solve one problem. If the patient has multiple problems, you have to solve all. Because you have to look at the whole anatomy as a whole, the whole body, which part of you. Everything is important, because one part affects the other part. I always say domino effect. So you must be all part of it, you know. Same goes for other conditions. Here you have obese patient with all the common thing, high blood lipids, you know, blah, blah, blah. I mean, this is a very common patient. You will always have all the time, you know. But because he's a chronic diabetic patient, he probably will also have other problems. He will have even eye problem, vision problem, you know. So this is where I give you an example that you have to go with this. So you notice there was one cell here called the mesenchymal cells. That is to do the stimulation. So if someone would have asked me, Mike, why don't you just give him the mesenchymal cells for his problem, all this problem? My answer is, it's not good enough, because you also have a liver problem. That's why you have a times 2 days, a double dose of the liver. Okay, you have high lipids, you know. So which one will work better to take away the liver, the fats from the liver? Obviously, you have to give back the hepatocyte. Okay, the hepatocyte is what the liver needs, because it's the regenerative cells of the liver. Remember, the liver has 75 cells. These are the one out of the 75. So when in the lab, when we do the production, we have to isolate the hepatocyte from the liver. That's what we are doing here. We are going to very specific cells. And that is important. Okay. So same for the pituitary, we need the pituitary. Okay, that guy still want to have a sexual function. So we even have to think of testes or whatever. We may. It depends on the condition and the age of the patient. Okay. The same goes for other things. When you notice, it's not just to give the stem cells or follow up with the microorganisms or the nano-organopeptides of the oral. If that patient cannot afford the stem cells, we will move down to the live cells. If we cannot afford the live cells, we have to move down to microorganisms. Okay? Or we can mix the human stem cell mesenchyme with the microorganisms, or the peptides NOP with the microorganisms. We can, we can do a lot of variation, put it this way. Okay, we can still have the adult stem cell if the patient insists they want the mesenchymal cells. We can still have that and put this. So the mesenchymal cells can be the animal and the human, but you cannot have the other cells from the human, right? So it's only the mesenchymal cells. So again, for insomnia, you notice we need the pineal gland. Okay, if you don't give the pineal gland, where is the release of melatonin? The release of melatonin comes from the pineal gland. It stimulates the release of melatonin between 9 o'clock to 10 onwards. Okay, so that is the right time for the release of melatonin. That's why a lot of us, after a certain time, we cannot sleep anymore. We become more awake in the later night, because the release of melatonin is gone. Okay, so if you want to make someone to sleep and not rely on sleeping pills, then obviously the pineal gland will be the best part. Okay, and of course you will fine tune with the rest of the other things, because when you treat a patient, like I say, you also have other complications which will also affect his sleep. Okay, so all this has to be taken into account. And again, with gout problem is a kidney problem. The kidney is not filtering good enough. So you have to repair the kidney and take care of the kidney. And of course, you also have to give the other cells. This is the way to go with it. And it continue and continue. We have a lot of chart on all this. Okay, there's so many charts we cannot be putting into the PowerPoint because it's so much. Okay, even for chart like this is found in the stem cell book here, which we wrote. Okay, and it was sold out in Amazon once, and it comes in 4 languages of the world, including Arabic, So it's important to understand the situation here. And if you look at Almonds disease, we give on the left side, the recommended targeted precursor stem cells for Almonds disease. Look at the cells we give there. It's not just one brain cells. It's a combination of a number of brain cells here. This is the right way to treat the Alzheimer's patient. It's not only one type of cells. Then after this treatment, when we inject the stem cells, it's IM. Why are we doing IM? Because there's so many amount of cells. You cannot do IV here because there are so many. Now, please understand, anything on IV has to be very diluted. Because if you make it too concentrated and fragments of cells like this is very thick, and you inject by IV, the patient will be hospitalized, I would say that. And again, the cells, when by IV, a number of cells are trapped in the lungs, more than 90%. So it'll be good for the lungs. It may not home to the other address. Please bear that in mind. Okay. Then again, the question of why don't you do intrathecal then? Because you're going with the brain. Okay. And you have the cerebral spinal fluid which is moving 24 hours a day. Okay. Certain time it will open up. So we have been doing that for a lot of patients. In the past, we used to do lumbar puncture intrathecal, but sometimes the patient or the physician themselves do not want it. And sometimes there's too many brain cells here. Because if you want to inject 20 ml of brain cells into the through the lumbar puncture, you also have to remove 20 ml of the cerebral spinal fluid. If you inject 20 just like this, then the patient will get unstable. Okay, and he may be hospitalized too. So you have to release, take out some, inject some, replaced by the same amount. So when you're having too many brain cells, you may not have enough, you will still have to inject IM. But IM is always the safest part to inject. Okay, intramuscular is always the safest part. We do a lot of subapolneurological too in Germany and Switzerland, but these days we do IM because it's safer. We want safety first. We don't want complication with the patient, and the doctor will be afraid when they have complication too, So these are on ADHD, and all the different types of spectrums, and we give different types of brain cells again, because autism, Down syndrome, cerebral palsy, global delay development, these are all neurodevelopmental diseases. Compared to the earlier one, is degenerative. This is developmental. Okay, so you again have to give the right brain cells, or it won't work. Just like in autism here, you look at the amount of different types of brain cells you have to give. All this chart is found in the book, okay, and given to the physicians. Our physicians who are with us all the time, they have a lot of information for us, and we always support. Okay, so again, support is important. Because when we talk about support, we are talking about all the centers with hundreds of doctors in different centers of our world who have experiences. It's just like you having an Alzheimer's patient or multiple sclerosis patient or ALS patient. For some doctors, it may be the first time they encounter. But to people like us who deal with 80 countries, doctors across 80 countries, of course, we are doctors who ordered and we have tried something on them. We know generally through the experience what really works and what really don't work. Because in this field, you need clinicians. Clinicians are the people who really experienced it before, so they can give a better feedback. So with our database, we know to a certain extent, if you say autism, we're treating thousands and thousands of patients. So obviously we know which brain cells obviously you have to give. Okay, which part you have to give and which part may not have to give, depends on the condition of the patient. Again, autistic children have different disorder. It's not only on the brain. They could also be having a lot of heavy metals. So you'll be having a lot of gut problem, leaky gut problem. So it depends on the condition. We have to treat differently for every patient. And I use the word individualized treatments. The cells are prescribed, or the condition or the peptides are prescribed individually according to the condition of the patient by the treating physician. This is precise, individualized therapy by the treating physician. Now, Down syndrome, again, even in Malaysia, we have treated so many of them, hundreds and hundreds of them. We even have a book on Down syndrome, and we're having a book on autism coming up, 2 books on autism. So that is the experience we have. We are so confident of treating Down syndrome because we have been doing it for so many years. Same for autism, we have been doing it for so many years. So Parkinson, we have treated a number of them too, okay? So again, from different parts of the world, again, you notice most of the time, a lot of brain cell has to be given. That is important, okay? So the same goes for diabetes type 1, there's a lot of young children with diabetes type 1 today, and with the type 2 is so common, is one of our most common clientele topic, everyone is with diabetics, and we have to take care of their organs, okay? And we have to take care because end game, like I say, is a kidney transplant. Then what about stroke patient? Again, the earlier we treat, the better it is, because we do not want the neurons to go off. If you delay too much time, then the neurons will go off. So after the release from the hospital, the recovery stage at home, we have to go in very fast, okay? We have to give the different types of cells, including the brain cortex, the hypothalamus, the medulla alba, and why are we giving the liver, spleen, the placenta? Because they will work synergistically for that patient. And if this patient is a diabetic patient, then we have to add the diabetic formula into it. So this is what I always say, these are the real way of precision in treating a patient. Arthritis, rheumatoid arthritis. Again, we have to look into a lot of problems here, okay? And you also have osteoarthritis. So there are 2 types of arthritis here. And we have to look at the condition to treat, because rheumatoid arthritis is autoimmune. So when you have autoimmune, we have to treat the autoimmune way too. We have some other therapies for autoimmune, okay, where we have a few publications done too. So again, it is important to understand you cannot just sell a product or a therapy without evidence in science. So I always believe whatever we do, we must have publication recognized with the journals across the world. All the publications are done in UK, in USA. These are the main 2 countries we do our publication, UK and USA, okay? So far, I know we have 50 over publication on this, on all our therapies and our products. That is important. We don't use other people's publication because it's no point to use other people's publication and promote your own product. Because the question will be asked by the client, you have anything to prove of your own then? You don't. So it is important to show that, yes, we have done this before in another parts of the world. This is a peer-reviewed study. We have done it and these are published. It is important. I sincerely think it's very important. So a lot of time are spent with, not just with the medical team or clinician team, even with our researchers. We have a lot of them. The equal amount of researchers is even as good as the doctors, the medical doctors. There's a lot of researchers. So we spend a lot of time during the last 1.5 years because of COVID lockdown. We spent a lot of time at home. I was involved in more than 14 books actually. We start to write a lot of books, and some of the books are out and some are now waiting to be out. So one of the book was on stem cell and peptides on animal and immunotherapy. This is the first book on stem cells on animals because we are treating a lot of VVIPs plus the animals. There's a lot of VVIPs with a lot of animals, and they also want the animals to be having the best quality life, and that's what we did. So even in Kota Kinabalu, we have 2 vets in our team because sometimes we don't understand the name of the medication of the animals. So with a vet, we will know. So we do have all this all over the world. We have vets all over the world. We have to go with this, and we have to use our vet to take care of the animals. We are doing a lot of publications and research clinical studies are being done with ICOG study, recognized in USA at this moment with dogs, you know. So again, this is the book, and these are all the animals we treated. All the animals except the small dogs, the very small brown dog on your right, they're all from USA. Okay, and some of the dogs are very old. The reason why with the puppies are just born a week ago, okay, from an aging dog. Okay, we even bring the heat from 1 year to half year. So these are something which are working very well with us because the demand are getting very big now, you know. So we do that for the animals too. Now, we have been treating horses for many years in Europe anyway.